Good morning. My name is Julianne. Today I'm going to be performing your ear and eye assessment. Is that okay with you?
Yep.
Can I have your name and date of birth, please?
It is Rihanna Dene and it's 4501.
All right, thank you. So today I'm going to begin the eye assessment with just taking my pen light, and I'm just going to inspect her eyes, her eyebrows, the conjunctiva, or the top portion of the eyelid and the bottom portion of the eyelid. Just going to make sure that everything is symmetrical, that the eyes, that her pupils are straight and round, reactive to light. Perla, we're going to assess that throughout this exam as well. So as of right now, I'm looking at her, I'm assessing if her eyes are normal, her pupils are normal, her sclera is white and glossy, eyebrows are normal, conjunctiva, I'm just going to lift your upper lid here, red, 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 and red. So that is also a normal finding. If it wasn't a normal finding, it would be paler, which is indicative of anemia. So the next thing I'm going to do is I'm going to have the visual acuity test, which tests cranial nerve 2 or the optic nerve. I don't have a Snellen chart, but if I had the Snellen chart, I would have the patient stand 20 feet away from it, and I would have the patient read the bottom line that she can, and with that way I'll be able to test just where she's at visually, where she can see in comparison to the rest of the population. So one thing I'm going to have her do now is reading a standard sized newspaper. I don't have newspaper, so I'm just going to use my notebook, and I'm just going to ask you to read like the bottom there for me.
Here's without warning hips.
Okay, thank you. So reading, like the standard for reading, it's the normal size for just typewriting. She can read the optic nerve, cranial nerve 2. The optic nerve is working fine. So the next thing I'm going to do is ocular motility. I'm going to use my pen light, and I'm just going to ask the patient, or I'm not going to use my pen light, I'm going to use my finger. And I'm just going to ask the patient to follow me in the 6 cardinal positions. I'm going to briefly stop in between each, just to check that her pupils are accommodating. All right, good. So everything was good there. The next thing I'm going to do is the cover test. I'm going to have my patient cover one eye and look straight for me. And I'm just going to look into this eye with my pen light, and I'm going to see that the pupil is still looking straight as I look into it, and I'm going to ask you to uncover your eye. As I did that, her pupils remained straight as the eye was covered and as it was uncovering. So that is a good cover eye test. The next test I'm going to perform is a corneal light reflex. I'm going to hold the light a few inches away from like the middle of her, about her nose, and the light should shine back in the same part of each pupil. So I'm just going to take my light here, and I'm just going to look into each of her pupils and see that the light is bouncing back on each pupil in the same area, which is good. The next one I'm going to do is a visual red reflex. With this one, when I take my pen light, the pen light should be able to see a red reflex in each of her eyeballs, in each of her eyes. This just shows me it's just redness that I would see. So let me do that in the red one. All right, good. So that really completes the eye assessment. Pupils equal, round, reactive to light, and accommodation. Everything was good. Oh, wait, no, sorry, I have one more test. Okay, so for accommodation, I'm going to ask you to just look at my finger as I come close to your nose, okay? Okay, so that was the accommodation test. Sort of forgot about that. That's the accommodation test. With that, as I move my finger in closer to her nose, her pupils should constrict, as that was positive, so that went well. So additionally, I will also be doing an ear assessment on you today, as I said. So before I begin the ear assessment, I just have a few questions for you. Is that okay?
Mm-hmm.
All right. Do you have any like cochlear implants or hearing aids that I that you know of? No. Do you have any ringing in the ears that bother you? Any pain? No. Abnormal drainage?
No.
Nothing like that? Alright. So after asking that, I'm just going to inspect the ears, just going to make sure that I don't see anything abnormal, no deformities, nothing that points out and says, there's a problem. I'm going to look at her from the, they look straight for me, I'm going to look at her straight. They look symmetrical, no deformities, nothing at all, no abnormal drainage that I can see, same color as her face. So everything is good, everything's symmetrical there. Excuse me. So now I'm going to palpate the ears, just as I inspected them. I'm going to palpate the pinna. She's an adult, so I'm just going to raise the pinna just a little bit to look inside the ear as well. Alright. Do you have any pain or tenderness anywhere that nothing?
No.
Anything?
No.
No? Okay. So as I'm palpating that, I'm going to also palpate the mastoid process behind the ear. Any pain still?
No.
So upon palpation, I find that the patient has no pain, no tenderness of the palpation of the ears, and everything is firm, so that is a fine palpation. The next thing I'm going to do is I'm going to assess hearing, which is cranial nerve 8, the vestibular cochlear nerve. So I'm going to stand behind you really fast, and I'm going to just whisper a few letters and a few numbers. I'm going to ask you to repeat 3 or 4 of those letters, as many as you can to me when I ask you. But I'm also going to have you cover one ear, okay?
Okay.
Can you cover your left ear for me?
Yes.
Alright, I'm just going to whisper and I want you to tell me what you hear, okay?
Okay. A, B, C, 1, 2, 3.
Good. Alright, I'm going to do the same thing to the other side, so can you cover the right ear?
Yep. X, Y, Z, 2, 2, 3.
Good. So the patient here did recall all 6 numbers and 6 numbers letters, so that is a fine test. However, with an elderly patient, they might be have some trouble hearing, so it is still normal to have the patient recall 3 letters or numbers. So the next thing I'm going to do is I am going to do a Weber test. This is assessing for unilateral hearing loss. I don't have a tuning fork, but I'm going to try it with a spoon. So I'm just going to place this on top of your head, and I'm going to hit the back of the spoon, and I'm going to ask you if you hear any vibrations, okay?
Okay.
Now this isn't really going to work, so we're just going to pretend, okay? So if I hit that, the patient she can't really hear any vibrations with the spoon, but the patient should be able to hear the vibrations bilaterally. That is a normal Weber test. So the Rhine test is also another hearing test. It assesses hearing, assessing hearing by bone conduction versus air conduction. So indicative of, or not indicative, but it's especially important to test in patients who suspect conductive hearing loss. So also, I don't have a tuning fork, once again, so I'm using a spoon. With this, I'm just going to place it on the mastoid process, and I would hit it as it would vibrate. I would ask the patient to say now when she heard the beginning of the vibrations, as I'm checking my watch, watching the seconds, and then I would move it perpendicularly to her ear, and I would ask her to tell me when the vibrations have stopped, still looking at my watch. This would mean that air conduction is heard twice as long as bone conduction. That would be a normal result for a Rhine test. This completes the ear and eye assessment, so thank you.